Hey mama, it's Jocelyn here. I have 4 kids of my own. I am pregnant with baby number 5 and I have had a miscarriage. And today we're going to talk a little bit about what are your philosophies for birth? What do you desire in birth? Because pregnancy is a culmination and a preparation for that big moment. That moment when you get to meet your little baby that you have been growing for 9 months. I am getting closer to having baby number 5, like less than 2 months away, and this has been on my mind, as I'm sure it has been or will be on your mind. These are good things to think about that I was not aware of when I was a first-time mom. So I'm hoping that by sharing some of the information and things that I have learned, that I can help you out and have your experience when it comes to birth and labor and delivery be a little bit better, as hopefully you're able to think about and kind of prepare your mind for what you want in a birth. Hi, I'm Jocelyn, host of the Positive in Pregnancy and Motherhood podcast. I help pregnant women and mothers to find positivity in their season of life through changing their thoughts to work for them and not against them. I help mothers find the small, doable steps in thought and action without making drastic changes to their everyday mom life, and I can help you. Thanks for joining. Okay, so there are 3 areas that you can kind of focus on when it comes to your philosophies for birth. There's the labor, which is like how you want to get through and go through the contractions. Excuse me. There is the pushing, which is pushing the baby out. And then there's newborn care. So I found myself getting all wrapped up in preparing for the labor and the pushing, because that seems like the hard part. And I wasn't thinking about the newborn care until I had talked to my doula, and she was going over some of the stuff they do with newborn care that I didn't think about, didn't realize, because it just hasn't been on my radar. It hasn't been on my mind. So we'll try and go through these areas to help spur ideas or thoughts or things you haven't thought about yet to help you to form your own philosophies for birth. I don't want to tell you how to do it. I want you to be able to decide for yourself based on the information that you have learned. And sometimes if you don't know something that you don't know, it can kind of cause frustrations. And so I think if we get a little bit more educated on some of these things that can come with labor, birth, and delivery, it can help to eliminate some of those frustrations and make the overall experience of birthing your baby a whole lot better. So I am going to discuss 5 areas in each of these sections. Now, there is a lot that we could go into on on each of these topics. So this will kind of be a summary, but know that I'm wanting you to do your research and to find out some of the things about labor, about pushing and delivery, and about newborn care to help you through. And parts of this may be for more Americanized, as I talk a little bit about vaccines towards the end of the newborn care, but we will get there, and it's still relevant questions that you can think about. So I think the first thing to think about with labor is, are you going to labor, or are you going to have a scheduled C-section? So think about that. Do you want to be induced? Do you want to have a natural birth? Some things to think about if you are going with natural. Do you want to labor in water? Does your hospital allow you to labor in water? Something that most hospitals do is they will monitor baby. Do you want to have a monitor on all the time, or do you prefer intermittent monitoring? Would you like to be able to move, or would you prefer the epidural? If you get an epidural, you're not able to move. You are stuck in your bed because the epidural basically makes it so you can't feel from where the epidural is down. And so you're not able to move. So is that something that's important to you? Something they also do in hospitals typically is they will do cervical exams. That means they'll check your cervix. They'll kind of put their hands in your area and check how dilated you are. How often do you want those? So those are 5 areas that you can kind of think about when it comes to labor and delivery. When it comes to pushing, I want you to think about pushing. So if you have an epidural, your choices are going to be limited. And a C-section does not relate to this because they just cut you open and take the baby out that way. But if you are wanting a natural, unmedicated birth, or at least without the epidural, I want you to think about some of these pushing options. Do you want to choose how you push? Like, do you want to be on your side? Do you want to be kneeling down? I feel like that's hard to decide because you don't really know until you're in the moment, but that is one thought to think about. Would you like a warm compress for your perineum at pushing? So what that means is, would you want like a warm, I imagine a blanket or some type of towel that can help warm your perineum up so that the tearing isn't as bad? Do you want an episiotomy? An episiotomy is where they cut your vaginal area to make more room for the baby. Do your research on that one. I'm not going to give my opinion on that one in this episode, but do your opinion on an episiotomy, on whether or not you want one. An episiotomy can be whether you're on the epidural or not. And actually, so the warm compress could be as well. Do you want the placenta to deliver naturally, or do you want them to help the placenta along? These are things that just don't always come to your mind, but definitely should be thought about. And do you want Pitocin after you birth a baby? I found out recently that at my hospital and with my midwives, they prefer to do Pitocin right after. Is that something that you want? These are things that need to be pre-decided by you, or at least thought about before you go, or you're just going to be subject to what they typically tend to do, and you won't have as many, you might not have as many freedoms. How about that? Always discuss these things with your doctors, with your OBGYNs, or with your midwives. And also be aware of what guidelines or rules or what the hospital does. Like, some hospitals allow birthing pools and some hospitals do not. If you're wanting to labor in water, but your hospital does not allow you to does not even offer birthing pools, that's going to be tough. And it's going to be a lot better to find these things out before than be in the situation and freaking out because you're not able to do it the way you were thinking you were able to do it. Information and knowledge and thinking about these things can definitely be a good thing. I am grateful that I have learned about them, and I wish I would have known about them sooner. Okay, enough of that caveat. Let's go on to newborn care. Okay, so when it comes to newborn care, I'm just going to go through around 5 or so. I've been tending to ask more questions with each topic, but it still gives you things to think about. So after the baby is born, it's still connected to your placenta. Some people believe that it is... So doctors tend to kind of cut that cord pretty quick. Midwives and other more natural professions tend to think that delayed cord clamping is good because it allows all the blood that's inside that cord to go back into the baby. So do you want a delayed cord clamp, or do you want that cord clamped or cut right away? Something to think about. Do you want skin to skin with your baby right away? Or are you okay with them just taking the baby to measure and do all the things they do? Another question and thing to think about is, are you wanting to breastfeed or are you wanting to bottle? Or both. I've done both in the past with breastfeeding as a preference, but these are things to be thought about when it comes to your newborn. And this is the part where I get to the vaccines. So in hospitals, there are different... I'm not going to go into the vaccines and the things that they often do at the hospitals, but I want you to be aware that they are going to ask you. And you need to be prepared to know which vaccines and which things you want for your baby and which ones you don't. So I would talk to your provider, talk to your midwives about what is kind of what they like to do or what the pediatricians at the hospital like to do, so that you can be prepared with your research to be able to give a good answer, or to give an answer that is suitable to you and what you desire for your baby. This is your choice. And I think sometimes we feel like we don't really have a choice. We just have to do what they say, but we don't. We have the options to say, no, that's one I don't want. I am okay with this one, but I'm not okay with that one. So do your research on those types of vaccines and things that they like to do for baby after birth. Another thing to think about that didn't even cross my mind until I had baby number 4. And it's how that, like, do you want your baby immediately wiped down? Now, prior to baby number 4, I was like, yeah, I would like the baby wiped down. Like, it's covered in who knows what that came with the birth stuff. I would like the baby wiped down. But then with baby 4, I kind of learned that sometimes they delay wiping the baby because the baby's skin absorbs a lot of the stuff around it. And do your research on this. And actually, I need to do more research. As you can tell, I'm not super educated on it, just that I know that it is something that should be thought about. Or could be thought about, that you just don't really think about. Anyway, there could be health benefits for that, or it could be something that you're just like, I'd prefer the baby to be wiped. I'm fine with that. So that should give you a lot to think about for your philosophies for birth, especially if you're a first-time mom. If you've been through this, a lot of these maybe you could answer, and some of them maybe not. And we may even do further episodes on this because there is a lot that you can think about and go into when it comes to philosophies for birth and your preferences and things you want. One of the hard things can be is maybe you don't know what you want. Especially if you're a first-time mom, it's hard to know where you want to labor, how you want to labor. Ask other women their opinion, trusted women that have good experiences with a similar birth like you. And just keep going, keep trying, but be thinking about some of these things so that you are prepared. I am cheering for you. If you are in that sick phase of pregnancy where you're just so sick and so miserable, I have a course called the Morning Sickness Mini Course for Mental Health. And what this course is designed to do is to help you when you are in that sick phase of pregnancy and puking all the time and struggling in all areas of your life. It is mini videos, mini meaning shorter. They're less than 10 minutes, all of them. And there's 42 so that you can have options and find the ones that resonate with you. And this course can help you to find positivity during that time when it is so hard to be positive. I struggled immensely during that time, and I have, but I had this course for my 5th baby, and it helped me to work on that negativity and to find ways to get through it. And that's what I want you to do. So if you're in that phase and you're struggling with that morning sickness or all day sickness or evening sickness, look into that. It's the top link in the show notes, and I'd love to help you get through that. Thank you for listening. Thank you for giving this podcast a rating and review. That helps other women to find it. Thank you for sharing it with other women that you know. But most of all, thank you for implementing these things into your life to find more positivity and to prepare yourself for what is to come, the amazing birth of your baby. Until next time, thank you for being a part of the Positive in Pregnancy and Motherhood podcast, for listening, for sharing, and most of all, for applying these tools into your own life to improve your own happiness so that you can find your own better thoughts for a better you in a positive pregnancy, in losing that stubborn baby weight, and becoming the mom you desire to be through taking small steps in thought and action to reach your goals. If you are a mother who has an inner desire to enjoy motherhood and pregnancy better, but you are having difficulty figuring it out, I can help you. I can help you find the small, doable steps without drastic changes to your everyday mom life. Reach out, let's connect, and let's see you move forward. My name is Jocelyn, and I thank you for listening. Until next time.